Hello and welcome to Aging Matters, a program featuring individuals who talk about aging-related issues of interest to older adults and their families. I'm Cheryl Beversdorf, your host. Vertigo, or dizziness, affects some 70% of individuals age 65 or older. In some cases, an inner ear disturbance may be the cause. At other times, age-related health conditions may be involved. For older adults, diagnosis and treatment of vertigo or dizziness can be challenging. Today, my guest is Dr. Patrick Maiberger, an otolaryngologist with Ear, Nose, and Throat Medical Group of Washington. Dr. Maiberger will talk about causes and risk factors for vertigo and also diagnosis, treatment, and prevention of the condition. Later in the program, Dr. Maiberger will perform a series of tests on his patient, Mr. Branca, to determine the cause of his vertigo. So welcome, Dr. Maiberger, and thank you for joining me today.
Thank you for having me, Cheryl. It's a pleasure to be here.
Well, let's just get started in terms of where this dizziness and vertigo really kind of originates. So explain to us, what is the vestibular system and where is it located? What's its function?
So the vestibular system is a fairly complex system located mostly in the inner ear, both ears. It makes up half of what we call the vestibular cochlear system. So half of it's hearing, but the other half is the function of balance. But also, two other important aspects of the vestibular system are vision, lets you sort of see where the horizon is, make sure you're walking in the right direction and which way up and down is, and also little sensors in your hands and feet to let you know where they are. And all of that input from your ears, your eyes, and your hands and feet is put together in the cerebellum within the portion of the brain and gives you coordination.
So I think probably one of the things that's most difficult for all of us to understand, myself included, is these various terms that you hear. You hear vertigo, I mentioned in my introduction, dizziness, but we also talk about imbalance. So give us a definition of each of these terms and kind of what are we going to be focusing on?
Absolutely. We're going to be focusing on vertigo.
Okay.
And vertigo really is the sensation of spinning. So you're either sitting there and you feel you're spinning or the rest of the room is spinning around. So you feel you are steady, but you feel that everything else is moving around you. Dizziness and imbalance, I kind of lump together. Also, I would use the term disequilibrium. And the sensation with that is more, I stood up too quickly. So that sort of lightheaded feeling. Now, English doesn't have great separation between all three of those terms, but in medicine, vertigo really is that sensation of spinning or movement when you're still, and then lightheadedness. And
my sense is that these three terms could be all applicable to older adults.
Correct, yes. And part of our job when we're discussing and trying to diagnose somebody's vertigo is, are they having vertigo or are they having more dizziness? Because those two can be separate issues.
And so, and I would assume that the causes might be different for each of those terms.
Absolutely.
But since we're focusing on vertigo, explain to us, so what are the common causes of vertigo?
So there really are 4 or 5 common causes of inner ear related vertigo. I know actually I was watching an earlier program, one of which was on stroke, and vertigo can be one of the symptoms of stroke, but typically there's going to be other symptoms, facial weakness, things like that. What we're talking about is really inner ear related vertigo, where the main symptom really is just vertigo, maybe some hearing loss. And so the main causes of that, and the most common one, is something called benign paroxysmal positional vertigo, or BPPV for short.
Probably better to just be
absolutely
BPPV.
Or the other one is, and your friends may have noticed that it's fairly common, these little crystals in your ear or the rocks in your ear that are out of place. That's the most common one.
Okay.
Otherwise, it can be related to migraine headaches, which is actually fairly common. About 10% of vertigo is migraine headaches. There's an infection of the inner ear called labyrinthitis or viral neuronitis. And then finally, the 4th most common cause is something called Meniere's disease, which is a disease of the inner ear that can cause vertigo and hearing loss.
And with these various causes, are there certain risk factors that older adults might have that
Sure.
What causes?
Older and all ages really, but certainly amongst the older population. In terms of the positional vertigo, the most common one, typically we don't know what causes it, but there are some risk factors. Getting your hair washed when you're going to the hairdresser, for instance, and leaning your head back sometimes will trigger it. Dental visits, especially if you've had any sort of drilling or dental procedures. Yoga, I've had people who've yoga or a massage. Sometimes where your body's in an unusual position, and most commonly just tossing and turning in bed. In terms of the others, certainly if you have a history of migraines, that is a risk factor for getting vertiginous migraines. And then Meniere's disease, we do see a little family history with that one.
And might there also be some health conditions? I mean, again, we're talking about older adults who oftentimes have different types of situations.
Yes, and that kind of comes
say?
down to the distinction between vertigo and dizziness as well. But certainly, age in general is a risk factor for having vertigo. It is more common the older we get. Medication certainly can cause it too. That usually is more lightheadedness and dizziness, but still it all can feel the same. So those medications could be something, blood pressure medicines are classically associated with being a little lightheaded. Again, that feeling of standing up too quickly. Diabetes medications are patients who suffer from diabetes. If the blood sugar gets a little bit low, you can start to feel lightheaded. Alcohol certainly can have that effect. Any other drugs of abuse, marijuana, things like that, which is gaining in use
it's getting
and
much
popularity.
more visibility. And
I'm not sure about CBD oil. I know that's sort of a pretty common and more popular remedy. But those are sort of the main risk factors. Those are the main medications that can trigger.
And in any particular health conditions, then, like a stroke or?
Well, certainly general imbalance, yes. A stroke, any sort of vascular issue.
Okay.
Autoimmune disease too.
Okay. So explain to us exactly what the signs and symptoms are of vertigo. You've kind of been telling us a little bit about the difference.
Right. So each of those disease entities, those common ones, has slightly different presentations in terms of the general picture. But essentially what happens is people will, when you have vertigo, and you know when you've had vertigo, because it's such a unique and difficult feeling. But basically oftentimes you'll wake up or you'll be sitting there and it's like you are on a top. Suddenly the room starts spinning around. The other one, the one comparison to people who've never had it, if you're a little kid, you remember you put your head on the baseball bat and run around. That sort of is that sensation of movement. And it can last anywhere from seconds to hours to even days if it's severe.
And does it matter? I mean, interestingly, I've had BPPV, so I know what you're talking about. And it seems like it could be more on one side or the other.
Absolutely.
Like when you're lying
so
down?
when we're talking about BPPV, it is positional and it usually is one-sided. So you're laying in bed, you decide, oh, let me roll over to my right side, and then suddenly the room and the world spins.
Yes.
And it lasts a few seconds to minutes. Now, if you roll on the other side, say your left side, you're totally fine. It's a positional component. There's a certain position that does it.
And again, just so we understand, so that's because the crystals have
Correct.
gone out of where they're supposed to be.
Exactly. So the crystals are supposed to be in a certain part of the inner ear, in what's called the utricle or saccule of the inner ear. And the inner ear, the remainder of it has this one section, which I just referred to, and the rest of it have these little semicircular canals. They look like little half circles. And those crystals float out from that utricle and saccule and get into those semicircular canals. And when you lay down in a certain position, boom, the room starts to spin.
So somebody comes in with these kind of symptoms,
Yes.
and they're a little vague.
Mm-hmm.
What kinds of tests would you be thinking about that you're going to
So the most
do?
important part actually is getting down to the history. What happens? Are you lying down? Does it last a few minutes? Once we get down that history, we move on to the physical exam. And that is testing coordination, it's testing balance. There's a specialized test looking for the crystals or the rocks that we'll show later. And after that, if we haven't found anything or are suspicious, we'll order hearing tests, because again, hearing and balance are the same organ, so sometimes you can pick up on some issues with hearing and your balance system. And there are even more specialized tests, what's called a VNG test, for example, vestibular nystagmogram, which basically tests the strength of your inner ear.
So, and you usually have to perform all of these tests then just to...
Certainly at minimum, you need a good history, a good chat to sort of see what's going on, and certainly that physical part where we're testing the balance system.
And I just am sort of curious, is obviously this is aging matters, but is it true that anybody, it's not just older adults that might be having this vertigo?
Again, well, if we focus on the crystals, it is more common, but certainly people in their 20s, 30s can get it. My wife had it when she was pregnant with our second child.
Oh, wow.
So,
okay.
Yeah.
So, okay, well, we're going to observe a series of tests performed by Dr. Maiberger on his patient, Mr. Branca, to diagnose the cause of his vertigo. So let's watch.
Hi, Mr. Branca, Dr. Maiberger.
Nice to meet you.
Nice to meet you too. I hear you're having some dizzy problems.
Yes.
I understand that it seems to be having some dizziness when you're in bed?
When I roll onto my left side.
On your left side, very good. And when that happens, how long does it go on for?
Usually just a few minutes.
A few minutes, perfect. Not for hours?
No.
Okay. And just on your left side?
Just my left side.
Excellent. So I have a decent idea of what might be going on, but I'm going to do some balance testing to test your balance system, your vestibular system. So first what I'm going to do, I'm going to just examine your eyes and check the eye movements to make sure those are connected to your ears well. So what I want you to do is keep your head still and just follow my finger for me. Just with your eyes. Perfect. Just like that. What I'm doing is checking to make sure your eyes are moving in a smooth way and they're moving equally together. And we're going to go in all the way. That looks great. Very good. The next thing I'm going to do is test another connection between the eyes and the ears. And it sounds a little strange, but I'm going to shake your head back and forth and see if your eyes start bouncing back and forth and it makes you dizzy. Okay, so just kind of relax. Move your head back and forth. Now what I want you to do when I stop is keep your eyes open. And I'm going to look. And in some folks who have a lot of balance issues, one of their ears is balance organs in their ear is weak, their eyes will continue to bounce. Yours is fine. So now I'm going to move on to checking the connection between your ears and the balance system in your hands and feet. So first what I want you to do is put your palms in your hands like that and flip it back and forth. And let's just check in coordination as well. That looks perfect. Let's try the other hand. Excellent. That is exactly the way it should be. If you're uncoordinated or there's a balance issue, your hands will move around and they won't flip as smoothly. Now I'm going to have you stand up and just check your overall balance. I want you to put your feet together, as close together as possible. Put your arms out in front just like that. And now I want you to close your eyes. And what we'll do is we'll stand here for about 30 seconds. By closing your eyes, you're really relying on your ears and the sensors in your hands and feet. And that seems fine. Go ahead and open your eyes. I'm going to make it a little bit harder for you now, though. I want you to stand with your arms out front like this and then march in place. Excellent. That's perfect. If it was abnormal, what would happen is you'd stand and march in place, and then you'd start to drift off to one side. So, for instance, if your left ear was weak, your balance system was weak, you'd start to drift off to the left side. Now what I want you to do, I want you to move back here. What we're going to do is I'm going to have you do what's called a tandem gait, just moving your feet in and out like this. Just go all the way to the end of the table and back. Perfect. So I have to say, overall, your balance system is intact. Seems to be working perfectly. So now we have to determine, are these little crystals in your ear out of whack? So to do that, what I want you to do is sit on the table here, swing your legs out for me, and move all the way, and move your body back so your head will hang off the end of the table. So the first part of the test we're going to do is to determine which side the crystals are out of whack. Is it the left side or the right side? And you seem to say it's the left side when you roll over. So we'll check the right first, which is probably an okay side. Lay back all the way, turn your head to the right. Now what I'm looking for is your eyes to start bouncing in a rhythmic movement called nystagmus. When that happens and you feel dizzy, that's a sign that the crystals are out of place. That seems fine, so I'm going to have you sit up. How are you feeling when you're sitting up?
Fine.
Fine. Good, so we'll do the same thing, but turn your head to the left for me. Perfect. And now I'm noticing a little bit of bouncing in the eyes. How do you feel? Do you feel like the room is spinning?
Yes, I feel
Okay,
dizzy.
perfect. It should get better in about 30 seconds. So what we did is what the maneuvers we just did is called a Dix-Hallpike maneuver. That's how we diagnose if you have benign positional vertigo. And now we're going to do the Epley maneuver, which is the maneuver we do to put the crystals back in place. So we stay just like this. This is step 1. We're going to turn your head to the right, 90 degrees, and hold it there about 30 seconds. This is step 2. What we're doing with those little crystals that are in a semicircular canal is we're trying to rotate them around that canal back into place. Now what I want you to do is to roll over onto your right side. So you're going to be laying on your right hip and your right shoulder. Good, and then turn your head down so you're facing the ground. That's perfect. So again, each movement's about 90 degrees. Now you may experience a little bit of dizziness with each of these maneuvers, and that's okay. That's a good sign that these crystals are moving around. And again, you want to hold each position about 30 seconds to a minute. Okay, so now what we're going to do, I want you to swing your legs off the end of the table and sit up for me, just like that. You may experience a little bit of dizziness, but hopefully we've got those crystals back in place. We'll check you again in about a week or 2 to see if they're back in place. You have some homework though. The first thing is, I don't want you doing any sort of rapid movements of your head for the next 2 days or so. So reaching up into the cabinet or bending over and putting something into the dishwasher, you have to be really careful. I want you to stay off of your left side when you sleep. You want to let those crystals cement back in place, and if you stay on the left side, they may knock back out. And we'll do that also for about 2 to 3 days. You can expect a little bit of dizziness, but it should subside, and hopefully you'll be right as rain in a week when I see you again.
Thank you.
You're welcome.
I hope the demonstration you just saw helps to understand what vertigo is and the types of tests an otolaryngologist uses to diagnose the cause in a patient. So let's talk a little bit about this. We just had this demonstration now. So you did the various types of testing. How do you determine what the treatment's going to be?
So in the demonstration case, it came back and found that he had the crystals, the positional vertigo. So I performed what's called an Epley maneuver, which is to move those little crystals from that semicircular canal back into the little cup, the utricle and sacula, where they're supposed to reside. And for positional vertigo, luckily, that's usually all you need to do. It may need to be done more than one time, and it may come back, but it's a fairly simple solution. For the other causes we mentioned, medication and other treatments are necessary.
And so in and of itself, this BPPV, that's all that's really necessary. There isn't any further therapy that's needed? Or
so if
what happens?
If it works well,
yes,
that's it. You're done. Those crystals have gone back in place until they pop out again. It doesn't always work well all the time. So vestibular therapy, which is a specialized form of physical therapy, can be very helpful for that. If all else fails and you're miserable, the crystals won't come back in, you're dizzy all the time, there is a surgery to correct it, in which you drill out the bone behind the ear and find that little semicircular canal and then plug it off so the fluid can't move around anymore.
And is that an outpatient procedure, or
it is? It usually you stay overnight, at least in the hospital, because you can be fairly dizzy afterwards. But if you do well, you can go home the same evening. It's not done commonly though, because most of the time the Epley maneuver is successful.
And I just wanted to go back to the one you said sometimes the therapy is done by a physical therapist.
Correct.
Explain a little bit more what happens. Is this an ongoing kind of therapy then that the physical therapist does, or what?
So typically speaking, it depends upon the severity of the balance issue and the vertigo. It may take 1 or 2 sessions. It may take 6 to 8. Like any other form of physical therapy, the physical therapist who specializes in vestibular therapy will do an assessment and then determine how many sessions are necessary. But it can be very helpful. And in general, especially for an aging population, it really also helps strengthen the balance muscles, the core muscles, and in hopes will to help prevent falls.
So it's more than just the crystals.
It's more than just the crystals, absolutely.
Yeah,
It is more
yeah.
than just the crystals.
And what would be your choice here in terms of the therapy, or as you mentioned, the surgery, as opposed to medications? I mean, how do you decide that?
So it comes down. So what I will say for medications, for vertigo, especially positional vertigo, it is a physical problem that the crystals need to be put back. So medications may help blunt the symptoms, but it's not going to fix the symptom. The time, the Epley maneuvers, trying to get those crystals back in place, and balance therapy seem to be the things that fix it. One example of a medication, though, that is commonly prescribed that can help blunt the symptom is something called meclizine or bonine. It's over the counter. It's an antihistamine that helps suppress the vertigo.
And is it possible that this medication may also interfere with other medications that older adults?
It can.
Because that's always a concern.
It is, absolutely. It is an antihistamine, so it can make you fairly. It can be pretty sedating. It may make you pretty tired.
And make you dizzy.
And yes, exactly. And can make you even more dizzy. So typically speaking, the key for the positional vertigo, the most common one, is to get the crystals back in place. My analogy is often, if you break your leg, an Advil may help a little bit, but it's not going to fix the broken leg.
Right.
Meclizine may help a little bit with the vertigo, but it's not going to cure you of the vertigo.
So I guess we want to talk about prevention here. You said it might go away on its own, but is there anything that a person can do to make sure that this doesn't happen?
So I think the basis, what we think happens is there's been a tossing or turning, or your head's been put in a certain way to trigger those crystals. Trying to, as best you can, limit those movements, especially rapid movements side to side, can be helpful. Now, you still obviously need to exercise. If you need to get your hair washed, get your hair washed. Just be careful and deliberate in those movements. That's usually the best prevention.
And I guess, so we've also heard sometimes about nutritional supplements or other kinds of treatments. What are your thoughts about that?
For vertigo, I think as long as you get plenty of rest and a nice, well-balanced diet, I think you should be fine. There's rarely, if ever, especially in a good U.S. diet, there's not going to be any sort of nutritional deficiency that's going to trigger your vertigo.
One thing that also sometimes people have, again, as they get older, is some kind of a cervical spine deterioration. Is that a possibility too? Because
that certainly can trigger dizziness.
Okay.
The pain and neuropathy or nerve type pain can sometimes trigger a sensation of imbalance or dizziness.
Right.
Absolutely.
But that's not the same as the vertigo.
Correct. Rarely is it going to cause vertigo. And that's where we have to go back to that definition. Is it vertigo or is it dizziness?
I'm just sort of curious as to the older adults that you see. Is this a big deal in terms of a lot of people come with this situation?
Absolutely.
With vertigo?
I mean, at least a few times a day, I'd say, in my
Every
office.
day?
Every day. On average, I'd say I probably see somebody with vertigo at least. And the most common is positional vertigo.
Wow.
Yeah.
And is it more men than women, or?
Women a little bit more frequent, is a little bit more frequent than men, just a little bit, and that's just based on global numbers. Don't know why. No great reason why that we know of. Maybe women on average are living a little bit longer than men, so that could be possibly the reason behind it.
And so, as you said, it will disappear.
Before Dr. Epley created the Epley maneuver and Dr. Saman created the SPOT maneuver, the treatment of choice was just to let it go, but it can take weeks to months for it to go away. So a lot of people don't, as you know, really don't want to live like that, so we do these maneuvers in therapy.
And can people do this Epley procedure at home?
You can. There are great instructional videos. Actually, YouTube does have some pretty good instructional videos. I was just looking this afternoon at them. The House Ear Clinic, if you go to their website, has one. The University of Michigan also has some very good YouTube videos of how to do an Epley maneuver.
And so, but can a person do the Epley procedure or maneuver on their own, or because I'm just sort of remembering that somebody took my shoulders and kind of tossed me from one side to the other.
If you feel confident you can do it, the one thing I will say is you have to be sure of which ear you're doing it for, because that does matter. So the first step in the Epley maneuver, as we saw, is that you have to determine which ear is the affected ear, and that's the most important part.
And when you say the ear, so are you going if it's going on your
say when you roll over on your left side.
Yes.
And you lay back and you roll over on your left side in bed, and that makes the world spin.
Yes.
That's the ear you start the Epley maneuver on.
Okay, and so you start on this side
Start
and
on
then
that side,
and then
turn.
go to that. So you mentioned a couple of resources already. Any final comments in terms of so that you don't have so many patients who are coming in with vertigo? What would you tell them?
I think yes. I mean, certainly there are some good resources online. The Mayo Clinic, WebMD. Those are both two resources I usually find are quite good and helpful. And then, as I mentioned, YouTube has some great maneuvers for the Epley, E-P-L-E-Y maneuver, Epley maneuver. If you Google or YouTube that, it'll come up.
Okay. Well, I want to thank Dr. Maiberger and his patient, Michael Branca, for joining me today. This program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38 in Arlington, Virginia, or streaming live at those times on arlingtonmedia.org. Aging Matters is also on the radio. The program is broadcast every Tuesday at 2 p.m. on WERA-LP Arlington, 96.7 FM. And you can listen to all Aging Matters radio programs by visiting mixcloud.com/Aging Matters or tiny.cc/Aging Matters archive. Finally, both radio and television Aging Matters programs are posted on our Facebook page, facebook.com/Aging Matters WERA. Thank you for watching the program today. Please join me again for the next Aging Matters show. Until then, remember, age is just a number, not a label.